What if you had a lens implant placed in your eye and the implant did not age well? It actually opacified. And I'm not talking about posterior capsule opacification. I'm talking about the lens implant material became opaque and you became essentially legally blind. That would not be good. Well, there are materials that are used in the manufacture of lens implants. Let's talk specifically about acrylic lens implants. Not all acrylic materials are the same. There are two types of acrylic. There's hydrophilic acrylic and there's hydrophobic acrylic. The vast majority of acrylic lens implants in the United States are made of hydrophobic acrylic. Hydrophilic acrylic material is used in the manufacture of some implants. And I have learned over time, it's probably not within my comfort level that I would have the confidence that if I put in a lens implant made of hydrophilic acrylic, that it would age well in all patients. Hydrophilic acrylic lens implant material can opacify in a small percentage of patients. The mystery is if we place a lens implant made of hydrophilic acrylic into a patient, we don't know if that patient's lens will withstand the test of time and stay clear all their life. If I put in a hydrophobic acrylic lens, I know that lens will stay clear for the patient's entire life. If I place a hydrophilic acrylic lens, I always will have a little question as to whether or not that lens will stay clear for the rest of that patient's life. We have a patient who traveled from Tennessee to see us, and she received a Rayner Hydrophilic Acrylic Lens implant. And she received it in both eyes. Her right implant was clear. Her left implant, and I'll show you the slit lamp microscope video of her left implant, it was entirely opacified. So she was legally blind through a opacified hydrophilic acrylic implant in her left eye. We saw her June 5th and we scheduled lens exchange. Through the microscope, we could see that her anterior capsulorhexis opening was about 5 millimeters in diameter and it was centered. She had already undergone YAG laser capsulotomy. So we took her to surgery, and let me show you what we saw during her surgery. Here we can see our patient's left eye through the operating room microscope. You can see the microscopic vacuoles that are mainly aggregated in the center of the lens implant in the visual axis. These vacuoles appear to be more diffuse toward the periphery of the lens optic. This patient's best corrected visual acuity is 20/40 -1. We anesthetize the eye by infusing 1% non-preserved lidocaine, followed by infusion of OcuCoat viscoelastic to fill the anterior chamber. A Donnenfeld spatula is used to elevate the anterior capsular rim above the lens optic. Helon GV is then placed into the equator of the capsular bag to visco expand the capsular bag and to separate the lens haptics and optic from within the capsular bag. We initially try to dial the lens clockwise, but find that it does not rotate out of the bag easily. Therefore, a Connor wand was placed below the lens optic to elevate the optic and tilt the lens to allow us to use our micro forceps to grasp the edge of the lens and then use IOL cutters to bisect the lens and cut it into two halves through the middle of the lens optic. By cutting the lens into two pieces, it makes it easier for us to dial the left haptic out of the capsular bag, and this half of the lens
is placed into the anterior chamber where we remove it with our microforceps through our 2.8 millimeter incision. Then we are able to rotate the right haptic out of the capsular bag. Additional Helon GV is used to visco-dissect the capsular bag equator from the right haptic. You can tell that the lens optic does appear to be relatively thicker than most hydrophobic lens optics. The two halves of the lens are placed on the cornea and the lens is inspected. Then each half of the optic is viewed under high magnification through the operating room microscope. You can see the microvacuoles are mainly on the subsurface of the anterior and posterior surfaces of the lens optic. An anterior vitrectomy is performed, followed by placement of Helon GV into the anterior chamber. The Bausch & Lomb LI61AO 3-piece silicone lens is then placed into the anterior chamber. The anterior vitrector is used to remove any debris from the posterior surface of the lens optic. Then a Conner wand is used to rotate the haptics into the ciliary sulcus. Then the optic is pushed posteriorly, so the edges of the lens optic are posterior to the anterior capsular rim. Now this lens is in optic capture configuration with the haptics in the sulcus and the optic posterior to the anterior capsule. The Helon GV is removed from the anterior chamber by copious irrigation of balanced salt solution to rinse the anterior chamber. We're able to remove all of the Helon GV, and then we sweep the iris to ensure that there is no vitreous prolapsing into the anterior chamber. The corneal incisions are then stromal hydrated, and at the end of surgery, the eye looks perfect.
So we were able to successfully remove her hydrophilic acrylic opacified lens implant, perform anterior vitrectomy, and place a Bausch & Lomb LI61 silicone lens into her eye in optic capture conformation. And how did she see? Well, we saw her one day after her surgery, which is today. And so let's go to our conversation with her less than 24 hours after she had received her new lens and had her hydrophilic acrylic opacified implant removed. How was yesterday?
It wasn't as bad as I was expecting.
Okay, good.
So
And
I was a little nervous.
yeah, how do you feel now?
I feel great. I feel
any
much
pain?
better. No pain.
Okay. And how's your vision?
100% better.
Yeah.
Like I could not really see anything but like light.
Yeah.
And now I can actually see.
Did you have cataracts? Is that why you had your surgery originally?
I did.
Okay. You had your surgery in 2019?
Mm-hmm.
So it's 7 years ago. Tell me, where do you live?
I live in Tennessee.
Where in Tennessee?
A little town called South Pittsburgh.
Okay.
It's right outside of Chattanooga.
All right, great. And then they saw that your left implant was, how did they describe it?
They said it looked like there was a lot of debris on there.
Mm-hmm.
It was embedded.
Mm-hmm.
When he took out my piggyback lens, he said he even tried to see if he could clean it any, and he said there was nothing he could do.
So he said he can't do anything about it?
Well, he said that the only thing that possibly could help would be the lens exchange. The doctor I went to, he said he could do it, but he was worried about, because I've had retina tears in the past and other issues, and he didn't do it very often. So he said there's a guy in Texas that, I would recommend if you want to try to do this. So that's how you came into the picture.
So doctor that I don't know in Tennessee recommended you come see me.
Yes.
Oh, okay.
directly. Yeah, I mean, it wasn't that I just like Googled somebody.
Right.
Yeah, he named you.
Okay, cool. Well, you're good. Which eye
Yeah.
sees better right now, your left or your right?
Really, right now, I feel like my left does.
Yeah,
Because it's more crisp, clear.
Okay, good.
I mean, I see good out of my right eye, but I can tell that it's a lot better.
Okay, how old are you?
55.
55. Okay, so it sounds like your right implant is the same implant that you had in your left eye,
All right.
but your right implant looks totally normal.
Right.
So odds are it'll stay normal.
Good. That's what I was worried about.
Yeah, the left implant looks perfect, so you're good.
I'm glad I came.
Good, yeah.
I'm glad I came.
Looks like a success. Take your eye drops according to the instructions, and you can follow up with your ophthalmologist locally.
Okay.
And you should be just normal.
Okay.
Yeah, everything looks good.
Good.
All right, thank you.
I'm happy.
Thanks for coming all this way.
Yeah, I'm very pleased.
Okay, and email me or call if you have questions.
Okay.
But you're
I
pretty
will.
normal at this point.
Well, thank you. I
Yeah,
appreciate
thank you.
it.
Yes, ma'am. Good.
Nice to meet you.
Okay.
Thank you.
Good. So thanks to our patient for driving from Tennessee to Austin for her surgery. Thankfully, she did well. Her vision was 20/25 without glasses today, and her eye looked great. And she's driving another 14 hours from Austin back to Tennessee today. Thanks to her for traveling all this way, and thanks to her surgeon for referring her to us for her lens exchange. And I'm glad to report she's seeing great and her eye looks great.
So in closing, if you're a patient or if you're an ophthalmologist considering receiving a lens implant, I would be cautious about using a hydrophilic acrylic lens implant. Hydrophobic acrylic, good. Hydrophilic acrylic, I probably would lean against it and lean toward using a hydrophobic acrylic material. Hope this video was helpful. Thank you for watching, and I will see you on the next one. Bye-bye.